We're the green group. Our patient was 89 years old. He was sent to the emergency room, and we had to find the diagnosis of what was wrong with him. Procedure: we did a physical examination. When we listened to him to his heart through the stethoscope, we heard like a rattle sound. So it was like accumulation of fluid. That's what we thought it was. So we had to get the fluid out and like fix that so oxygen could get into the lungs and whatnot.
Go back for a second. I didn't see the vitals. Yeah.
Oh, vitals. Sorry. Blood pressure. It was seemed to be pretty normal. It was 127/86. And like I said, we had to get oxygen because the oxygen couldn't get through because there was fluid in the lungs, so that was like blocking it and whatnot. So it was pretty low, 81. And we gave him an oxygen mask, but that wasn't working at the time because we had to clear the fluid. And EKG was pretty normal. The interpretation, like I said before, we said that we came to the diagnosis that he had accumulation of fluid in the lungs, so we had to get rid of that, and he had congestive heart failure. Whatnot.
So, we didn't really know what to do, so I guess we just started thinking, all right, well, give him a couple drugs, see what happens. More than a couple, but no. So this was like, our first time. So,
He sabotaged our patient.
So he suggested isopropyl, which you previously knew. If the patient of heart failure. And he was like, yeah, so it's a paternal. Somehow that, we listened, I guess, I don't know. So heart rate decreased dramatically to 57 beats per minute. The blood pressure is 109/63, and he flatlined. We were sort of still in shock at this betrayal. Until the attending Dr. Dominic Glavin was like, do something. So we, defibrillated him. His pulse returned to normal, but then dropped to 54 beats per minute. His oxygen saturation is still 79, and it usually should be 99 or 100 almost %. So that was alerting us to the fact that we haven't solved the problem, obviously. Blood pressure was 113/75, and lesson learned, isoproterenol does increase blood supply. However, it should not be used when a person is suffering from heart failure.
AKA don't listen to Fernando.
Okay, so next we thought, epinephrine, why not? So we wanted to administer it in response to the drop in pulse because it's known to speed up the heart rate. Heart rate then jumped up, it was dramatically increased to 126. His EKG was then erratic, his pulse was 89, his blood pressure was 113/74, so we were going to need to do something else. Acetylcholine, it was then administered in order to increase the parasympathetic response and calm it down to neutralize the effects of epinephrine. So it went from 80 to 63 and then 46, which was very good. His blood pressure was 114/75, and oxygen saturation was still low. Unfortunately, at the time, we concentrated more on heart rate and weren't really looking at the main problem, which was oxygen saturation.
So then we gave atropine. And we administered it in order to increase the sympathetic response by blocking the action of acetylcholine. The heart rate increased to 51, but it then went back down to 46. The blood pressure stayed around 106/72, and oxygen levels still at 80, so that wasn't helping. Lesson learned, avoid atropine in patients, especially with heart problems. Furthermore, we sort of forgot that atropine has a long-lasting impact and affects other drugs that may be administered afterwards.
But we use that to our advantage.
But yeah, and also remember that. And remember from last WISER, we decided to give acetylcholine. We remember that it was known to give a reverse effect that mimics the sympathetic response. So the heart rate got bumped up all the way to 80 beats per minute. Then we gave chlorothiazide.
Now we try to concentrate.
Yeah.
No, now we try to address the problem with fluid.
Walgreens, like
No, we finally realized to like concentrate on getting rid of the fluid.
Fluids, yeah. The time told us that. And we knew that was known to reduce the blood volume. It's a diuretic. So we were hoping that would help with the fluid buildup. But the heart rate went down to 57, and then it slightly increased to 63. And the blood pressure was 107/69, so that wasn't too bad. And the last one, but the most successful, and the one we should have used, was furosemide, which leads to rapid fluid loss, and oxygen levels increased all the way to 94, which is what we sort of wanted. And the heart rate was stable at 71 beats per minute, and blood pressure was 110/69, and we heard no more rattling sounds from the lungs, so he was breathing normally.
So stable enough to
Yeah. And the result, he was referred to a cardiologist. However, his patient's granddaughter was angry that she wouldn't be inheriting his money. And we decided to notify our psychologist, so I might be contacting him shortly.
Thanks a lot. You guys.
Emergency room situation. Yeah, Janina, she gave me Tiva, and Kara, and Kara and Adrian as well. Okay, our girl was a 19-year-old lady was hit by a Port Authority bus. Off
490.
Yeah,
50-90.
off of Forbes, and she was immediately rushed to the ER. Her prognosis was excessive bleeding because her leg was cut off. It was decapitated with patella, meaning, Dominic King told us that her leg was the bus cut her in half. And she was only 19, so she's now a parent. Go ahead.
So the treatment option is we didn't really know, but then we kind of thought about it, and so by the time we realized eventually that isopaternal was the proper treatment, but because that was our only option. But ideally, we would want to apply pressure to stop the bleeding and manage the bleeding, and then increase blood volume via fluids. But then the fluids would also thin out the blood. So that would still prevent oxygen flow to the damaged tissue that didn't really have blood. So we would increase blood pressure and blood amount by blood transfusion. But since we can't do any of that, we use isopaternal. And isopaternal, it's used to increase heart rate and forced contraction, dilation of bronchs, which allows more air to flow enter into the lung, increase in fat and carbohydrate breakdown to form ATP. But the mannequin, when isopaternal was administered, linked to cardiac arrest and flatline. So, but it wasn't our fault. It was a technicality issue because
Guys,
Julia,
do not attack
Dr.
Julia.
Julia told us
No,
that.
it wasn't her fault.
She
was just saying
No, she
that
was just
they
saying that.
programmed it wrong.
Yeah. So
Sorry.
it would have lived. Well, it did live, but it would have.
She did.
Yeah, she.
It's not even a human being.
It's a 19-year-old female. Yeah. The girl that was on the second side. But
It's horrible.
but she would probably not have flatlined if she was reborn.
Okay.
And the vital signs, her heart rate was 77, her blood pressure was 50 over 30, and when she first,
Oh.
And after after treating her, we got her heart rate up to 122, and then her blood pressure to 83 over 50, and then it just kept going up. And the last time was 105 or something.
Good job.
So she was relatively stable.